All right, let's talk about urticaria, or as most of us know it, hives. Today, we're going to walk through the International Expert Guideline to really understand this incredibly common and, let's be honest, super frustrating condition, from what it is to how you treat it.
Here's what we've got on tap. First, we'll get straight on what urticaria actually is. Then, we'll look at how doctors figure it out. After that, we'll dive into the treatment ladder, and I'll explain exactly what that means. We'll also cover the options for when standard stuff doesn't work, and finally, we'll touch on what to do for kids and during pregnancy.
Okay, let's get right into it. If you've ever had that sudden, maddening itch pop up out of nowhere, this part is for you. We're putting a name and a clear definition to that experience.
So, what is this thing? The condition that can show up without warning and make you incredibly uncomfortable. It might feel totally random, but there's a real medical process happening right under your skin.
Okay, so the official definition has two main parts. First, you've got wheals. Those are the classic hives, the raised, itchy blotches that seem to move around your body. And second, you can get angioedema, which is a much deeper swelling, often around the lips or eyes. And here's the key thing about the wheals. They're temporary. A single spot is usually gone in less than a day.
And if this has happened to you, you are definitely not alone. About 20% of people will get acute urticaria at some point in their lives. That's 1 out of every 5 of us. It's a huge number, and it's exactly why having a clear, evidence-based guide like this is so important.
Okay, so how do you get a diagnosis? Well, it might surprise you that finding the right treatment doesn't usually start with a ton of tests. It starts with a conversation.
This is so crucial. The most important tool for diagnosis is your story. Your doctor is going to want to know everything. When did the hives show up? How long did they last? What were you doing? What did you eat? And a pro tip, take pictures. Your hives might not be there when you actually see the doctor, so photos can be a huge help.
Now, for most cases that clear up quickly, you probably won't need any tests. But if your hives stick around for more than 6 weeks, that's considered chronic, and that's when a few basic blood tests are recommended. We're talking about a simple blood count and some tests that check for general inflammation. They don't point to a specific cause, but they help rule other things out and give a fuller picture of what's going on.
All right, now we get to the heart of the guideline, the actual treatment plan. And it's not just a list of random drugs. It's a really logical, step-by-step approach designed to get your symptoms totally under control. The best way to think about it is like you're climbing a ladder. And here it is, the whole algorithm laid out visually. The goal here is ambitious, but simple: complete freedom from hives and itching. So, let's start on the very first rung.
Before we jump on that first rung, we need to talk about our main tool, antihistamines. The guideline is really clear on this. You want to use the modern, second-generation ones, not the older first-generation drugs. And why is that? Well, this chart says it all. The older ones can make you super drowsy and really affect your performance. The modern ones are specifically designed to avoid that, so they're much safer.
Okay, step 1. This is the foundation. You start with the standard daily dose of a modern antihistamine. And the key word there is daily. The goal isn't to chase symptoms after they appear. It's all about prevention. You take it consistently to stop the hives from ever even forming.
So, what are these modern meds? You've probably heard of some of them. We're talking about things like cetirizine, loratadine, and fexofenadine. They all work in a similar way. They block something called the H1 receptor, which is basically the docking station that histamine uses to cause all that itch and swelling.
So what happens if a standard dose just isn't cutting it after a few weeks? Well, we climb to the next rung. And this might be surprising. The guideline says don't switch drugs, but instead increase the dose of the one you're already taking, up to 4 times the standard amount. Now, this is what's called an off-label use, but it's totally supported by clinical studies and expert agreement. It's a safe and effective next move.
For a lot of people, that high dose does the trick. But for some, even that isn't enough to get the symptoms under control. For those folks, the guideline has even more steps on the ladder.
Step 3 is a pretty big leap. Here, we add on a medication called omalizumab. This is not just a stronger antihistamine. It's a completely different type of drug called a biologic. It works by targeting something called IgE, which is an antibody that helps trigger the whole histamine release. It's a much more targeted approach for those really difficult cases.
And right at the top of the ladder, for the most severe cases that just won't respond to anything else, is step 4, adding on cyclosporin. This is a powerful immunosuppressive drug. Because of its potential side effects, it's really reserved for people who've tried everything else, and it has to be managed very carefully by a specialist.
Now, there's one treatment the guideline very explicitly warns against for long-term use. I'm just going to read this directly. We recommend against the long-term use of systemic glucocorticosteroids in CU. We're talking about oral steroids like prednisone. A doctor might give you a short course for a really bad flare-up, but they are absolutely not a safe long-term solution, which is why they are kept off that main treatment ladder.
So that treatment ladder is a clear path for most adults. But what about kids or managing this during pregnancy? These are really important situations, and the guideline gives some specific advice.
For children, the main principle is always safety first. So modern, non-sedating antihistamines are the way to go. Several of them, like cetirizine, loratadine, and fexofenadine, have been shown to be safe for kids. But when you start talking about those higher steps on the ladder, like updosing or biologics, that requires a much more careful one-on-one consideration with a specialist.
During pregnancy and breastfeeding, that focus on safety is, of course, even more intense. And the good news is that no birth defects have ever been reported from modern antihistamines. Loratadine and cetirizine are usually the go-to choices simply because we have the most safety data on them. The bottom line is that there are safe options available to manage symptoms during this time, so you don't have to just suffer through it.
And that really brings us to the big takeaway here. This guideline gives us a clear, logical, evidence-based path from diagnosis all the way to complete symptom control. It really suggests that maybe, just maybe, the idea of having to learn to live with chronic hives could become a thing of the past.